You know, I recently did a video about Alex Earl's breast augmentation. She's an influencer and talked about getting saline implants under the muscle. And I talked about how I typically do silicone over the muscle into the subfascial plane. And we've gotten a lot of questions about why submuscular, why subfascial, and what's the difference. So I was going to show you that here today. This is a typical submuscular placement with the implant laying on top of the ribs. Now, for saline, that makes sense because saline ripples a lot. But the problem with under the muscle placement is that whenever you flex your pec muscles, you get this very freaky animation of the implants. And there's a picture of Leanne Rhymes that I've got here included for you to see what that looks like. Over time, the muscle can displace the implants down and laterally. And the other thing that a lot of surgeons are not going to tell you is over time, the ribs actually cave in. Because ribs aren't rocks, they're living materials, so they're going to cave in. So let's say you're elderly one day and you take your implants out, you're going to have a sunken zone where the implant used to be. When we go over the muscle, there's two ways to do it. This particular diagram shows what's called a subglandular augmentation, where the implant is directly behind the breast gland. I don't do that type of over the muscle augmentation because the capsular contracture rates are higher. Capsular contracture is when the scar tissue capsule contracts and makes the breast hard. But if you see this little thin kind of bluish purple layer on top of the muscle, that represents fascia, which is a sheet of connective tissue. I lift that off in a very careful, precise dissection, put the implant directly on the muscle, and the capsular contracture rates are virtually the same as under the muscle. You don't get that freaky animation. You can bench 200 pounds, you're not going to mess up your implants. So overall, I think it's probably the ideal placement for a breast implant.